I just want to thank the County Order for including this topical issue, and before I start I'd like to say that for anyone who needs an abortion, the HSE's My Options service will help you find your nearest provider. You can phone 1800 828 010 or go to myoptions.ie. Last week the news broke that the US Supreme Court has overturned Roe v Wade, the case permitting termination of pregnancies across that jurisdiction. It was a shocking reminder that rights established for decades can be very quickly removed. Equally worrying was the scale of celebration and pace at which lawmakers, primarily men, moved to restrict healthcare for girls and women. These events are a sobering warning. There were people here in Ireland, including politicians, who joyfully welcomed the news that the lives of girls and women were being put at risk. And we know that this is the case, especially in disadvantaged and minority communities. While the right to bodily autonomy and healthcare, including termination, because abortion is healthcare, has been established by popular vote here, we know that nothing is guaranteed. There are still groups actively working to deny the will of the Irish people and threaten our hard-won rights. However, we also know that the work is not completed here to ensure that all people who need it have access to free, safe and legal abortions in Ireland. Recent UK Department of Health figures show that 367 people from the island of Ireland were forced to travel to Britain for an abortion in 2021. That's 206 from the Republic and 161 in the North. These are just the UK figures of people giving Irish addresses. In reality, we know there are so many more. For those travelling from the Republic, the vast majority were over 12 weeks pregnant, with fetal anomaly cases being the leading reason. This is an indictment of our current abortion laws. These are not abstract numbers. Each one is a person being forced to leave the state for healthcare. In many cases, it is women and their partners enduring the pain of complicated pregnancies and fetal anomalies. These are heartbreaking and clinically complex situations. It is beyond disgraceful that our laws after repeal are still forcing hundreds of girls and women to travel for healthcare. They are in the midst of the most difficult and emotional decisions they will ever have to make, and then they have to navigate travelling to another jurisdiction, going through the chaos of Dublin Airport, or being fearful they cannot afford it in a cost of living crisis. People living in rural Ireland, working class people, disabled people, migrants, and people living in direct provision all face additional barriers. It's important to note that the Abortion Support Network is a UK charity which provides financial assistance, accommodation and consultation to people from Ireland and other jurisdictions to access care in Britain. Our laws are forcing suffering onto people already going through one of the worst events of their lives. The incredible work of Termination for Medical Reasons and all the courageous women and families who told their stories reveal the lived reality of this oppressive legislation. The current review of the Termination of Pregnancy Act must remove these cruel restrictions. Other restrictions also need to be addressed, such as the 3-day waiting period, which has no basis in medical science, or the absence of abortion services in large parts of our country. Recent events in the US have brought this situation back into the headlines, but it has been the lived experience for many since repeal. It's now up to the government to help them.
Mr. Abbott.
Thank you, Deputy, for raising this topical this morning. I think it's very timely in light of everything that has gone on in the US. Minister Donnelly sends his apologies, so I'm taking it on his behalf and I'm going to give you his exact script. Is that okay? And it is important that we acknowledge the very upsetting situations faced and difficult decisions made by people behind these statistics and the very sad circumstances that surround these terminations of pregnancy. As the Deputy will be aware, the Health Regulation of Termination of Pregnancy Act 2018 permits terminations to be carried out in cases where there is a risk to the life or of serious harm to the health of a pregnant woman, where there is a condition present likely to lead to the death of the fetus either before or within 28 days of birth, and without restrictions up to 12 weeks of pregnancy. Expanded termination of pregnancy services commenced on the 1st January 2019 and are provided through participating doctors and hospitals throughout the country. However, I am aware that the statistics reported by the Department of Health and Social Care in the UK show that women with Irish address continue to access termination of pregnancy services in that jurisdiction in 2021. I wish to assure the Deputy that this is a priority for my department, that the Health Regulation of Termination of Pregnancy Act 2018 is fully implemented and is performing as it should be, to enable all women in Ireland to access services quickly and easily without bias or judgment. There has been a substantial reduction in the number of people with Irish residence addresses availing of termination of pregnancy services in the UK since the enactment of the Health Regulation of Termination of Pregnancy Act 2018 and the commencement of services. There is regular ongoing engagement between the Department of Health and the HSE to facilitate the operation of the services and to resolve any issues that may arise, and will continue to ensure the positive rollout and the enactment of the healthcare. I'm also going to read the closing statement in this piece because it might add context to it. And 4 years ago, the Irish people voted decisively to change the Constitution and give the legislative responsibility to regulate termination of pregnancy services. And the people voted in the knowledge of the legislative proposals that would be proposed to deliver this outcome. In line with the statutory and government commitments, Minister Donnelly has commenced the review of the operation of the Act. The review will assess the effectiveness of the operation of the legislation and will be conducted in a fair and transparent manner. The review is being led by an independent chair and comprises of two main phases. As part of the first phase of the review, information of evidence on the operation of the Act is being collected from women who use the service and from health professionals that provide the service, along with the views of the public through a public consultation which closed on the 1st of April. And in the second phase of the review, the Chair will assess the extent of which the objectives have and have not been achieved and will make recommendations to address any barriers identified. The Chair is expected to conclude her report and provide a report to Minister Donnelly at the end of the year. This process will provide an important examination on how our termination services are operating and will give us a chance, where necessary, to identify improvements to the operation of the Act.
Minister, you said in the current legislation enables all women to access it. It does not. The 367 women who travelled to the UK that we know of, obviously it's many more, did not have access to the healthcare in Ireland, and it's deeply disappointing and concerning that the government is determined to only review the operation of the Act rather than providing the changes necessary to prevent further suffering. Can we honestly say that we're happy with the fact that women and families who have received the worst possible news are being forced to travel to another country for healthcare? The review of the legislation is a missed opportunity to update our laws in line with best medical practice and the lived experience of families. Regrettably, the lack of action and resolve on this and related issues is clear. The government has failed to bring forward promised legislation on safe access zones around GP surgeries and hospitals. Instead, the Together for Safety group have, in coordination with senators, progressed a bill where the government has failed to do so. Then there's the larger context of maternal healthcare in Ireland. We are for years, if not decades, away from a patient-centred system in which midwives have a leading role. We have shockingly low rates of home births in Ireland, with an institutional culture of forcing women into hospitals for this. Community Midwives Association and the Midwives Association of Ireland have called the HSE ban on water births non-evidence-based, unethical and inequitable. Over 3,000 women annually are hospitalised because of severe pregnancy sickness, when a medication that could assist in many cases is unavailable on the drugs payment scheme or the medical card. And there is a vastly disproportionate overrepresentation of ethnic minority women among maternal deaths in Ireland. All of these are issues are connected to how maternal and abortion healthcare are treated in Ireland. An unwillingness to provide the full range of abortion care needed by girls and women is the same unwillingness to provide the full range of proper resourced maternal health care. We need change.
Member to conclude.
Thank you, Chair, and thank you again, Deputy. I take on board everything that you've said, and I will bring it back to Minister Donnelly. But I think it's important as well, the point, I hear everything you said, but in relation to the drug that ends up where women end up in hospitalisation, I actually will bring that up again, because my understanding is that was to be progressing, that is the name of a caravan. Oh, I can't pronounce it, but anyways, that drug I will bring back to Minister Donnelly to actually get you an up-to-date as to where that is in the drug pricing scheme, because we all believe that that should be included. Thank you.